everyone. Welcome. We are here from the 12th Congress of the World Federation of Pediatric Intensive and Critical Care Societies. It's day one of the full program, and we're really excited today. We're going to be speaking to some of our morning plenary speakers, as well as some of our multidisciplinary professionals that are here, and we'll be talking about what are some of the highlights that are upcoming in the Congress. So I'm here this morning with Dr. Asia Algonik, who gave us a plenary talk this morning on her work with communication training, and I'm hoping, Asia, if you don't mind introducing yourself, who you are, what your profession is, where you practice, and then maybe one or two points that you'd like our audience to sort of take away for those that couldn't be at your plenary talk this morning.
Sure, thanks so much for this invitation. So yeah, my name is Asia Algonik. I'm a pediatric intensivist at St. Jude Children's Research Hospital in the United States, and I direct our global critical care program that focuses on improving outcomes for children with cancer who develop critical illness. And so I had the pleasure of giving a plenary this morning on teamwork in multidisciplinary pediatric intensive care. So some take-home messages that I hope viewers got, or if you weren't able to attend. First, the importance of teamwork to all of the care that we provide for critically ill children, that improving teamwork improves patient outcomes as well as provider outcomes, like reducing burnout, which is super important. The next idea is that we can think about teamwork as an outcome of interventions, and I gave some examples of interventions that have been shown to be evidence-based to improve teamwork within cardiopulmonary resuscitation during arrest, and that would be simulation as the intervention, among daily ICU care, and the intervention there would be interprofessional bedside rounds. And finally, for patient deterioration outside of the ICU and an intervention that improves teamwork there, are pediatric early warning systems. And then I talked about how to actually implement those interventions that work into daily care and some challenges.
That's wonderful. Now, I've known Asia for a very long time, and I remember when you were a resident and you went to Tanzania for the first time, and you were so passionate about this problem of getting kids to the ICU quickly, and it's amazing to see how this has grown and what you've been able to accomplish. So I have two questions for you. One, what would you recommend to early trainees and people that are just starting out their career as how they can take their passion and make it actionable? So maybe I'll start with that one, and then I'll ask you my second one.
Sure, yeah. I think it's really exciting to see the number of trainees that are interested in global health and implementation science. And I was in the experience where what I was interested in didn't really exist, and so I kind of had to build my way. But if you're motivated, you can do that. It's even better if you can find mentors, maybe not necessarily in the same content area that you're interested in, but maybe in similar methodologies in related areas. And mentorship comes in different ways. It can come with methodologic mentorship, like I just mentioned, but also career mentorship and just general support. Having that team of mentorships around you to help you grow and develop your career and make some of those important choices is really important. So that would be my main advice, is to find the right mentor, but also not to get discouraged, because my career also didn't go in a linear path, and I didn't know that when I graduated that this is what I would be doing now, but you have to kind of take opportunities as they come up.
That's wonderful. Now, what about those that are interested in joining your projects? How can they, connect with you?
Yeah, so our global critical care program, which works with any clinicians or hospitals that manage children with cancer, is open for everyone. It's totally free. You could email globalcriticalcare@stjude.org or me at Asya, ASYA.AGULNIK@stjude.org. And if you're interested in PEWS and how to support PEWS implementation in your setting, we work actually across settings in all of Latin America in Spanish and Portuguese, but also in English-speaking centers. So that is Proyecto EVAT. So Proyecto EVAT at stjude.org.
Awesome. Thank you so much for taking the time and talk with us.
Thank you so
much.
much.
Have a good rest of your conference.
Thank
you.
Thank
you. Bye-bye. Hi there. All right. Now we're here with Anne-Sylvie Remelet.
Yes.
Would you mind introducing yourself, what you do, where you're from?
Yes, well, my name is Anne-Sylvie Remelet. I'm full professor of nursing at the Faculty of Biology and Medicine at the University of Lausanne in Switzerland. And I'm the head of the doctoral program for nursing science.
Fantastic.
And I have a academic clinical partnership with the University Hospital of Lausanne.
Wonderful.
Yes.
Well, thank you for joining us. And I'm excited to hear there's a lot of implementation science and a lot of beautiful nursing implementation science that's happening. We've seen a lot of amazing presentations. I think I've seen 3 this morning already. So I'm curious, what are you excited about this Congress, and Why did you attend?
Yeah. Well, I actually have attended many WFPICCS in the past.
Fabulous.
So it's kind of a tradition, and after COVID, it was really exciting to actually come in person
Yes.
to WFPICCS and being able to meet in person all our colleagues from around the world.
Absolutely.
And for me, the plus of coming to Cancun was really to network, and so it's like, of course, like all the sessions are very interesting, and you always learn new things and cutting edge research and getting new ideas for new projects, new collaboration. But the networking outside the session is really important, and yeah, that's why I came to Cancun.
Fantastic. I love that. Any sessions in particular that you have on your session
My
favorites?
favorite list.
Yeah.
Well, I tend to go to very different sessions from multidisciplinary, outlook, but I always go to, the domain that I'm most interested in and that are related to my program of research.
Yeah.
So, like, for instance, this morning I went to the World Cafe with Martha Curley and Jeff Burns, and I went to the plenary session that was really, relevant to my, family research in pediatrics.
Absolutely.
And I also will look at all the sessions that are on long-term outcomes, because that's really, the way to go now, and we can't just focus on,
Totally.
stay, and everything that is related to interprofessional collaboration and of course the PICU liberation, like pain and sedation.
Totally.
Yes.
Well, I have, could you provide one recommendation? You are a seasoned WFPICCS attendee. What are maybe a junior person that's coming here to WFPICCS? What's one strategy that they should take to be successful here?
Well, they should go to the sessions that they are most interested in and go and introduce themselves to the speakers.
Yes.
That's how you get to know people, and people you may actually work in future. You never know. And attend the social event as well. This is really important. And don't be shy. And mingle around and make new friends.
Absolutely. Well, thank you so much.
Thank you.
I think that's wonderful advice, and I hope a lot of our new members will come and heed that advice. So thank you so much. It was nice chatting with you. Have a good meeting. All right. Hello. All right. Now we are here with Dr. Joseph Manning, who gave us a wonderful plenary this morning. And I wonder if you could introduce yourself, your profession, where you practice, and then tell us one or two key points that you hope our learners take away from your session this morning.
Sure, thank you so much. My name's Joseph Manning. I'm Professor of Nursing and Child Health from the UK. I work at University of Leicester and also Nottingham Children's Hospital as a clinical academic children's nurse. And the plenary that I delivered was really around post-intensive care syndrome. And trying to illuminate some of the complexities and challenges and oftentimes the hiddenness of survivorship, and for not just for the child but also for their family, which includes parents and caregivers and also siblings. So that was what the plenary did. It outlined the conceptual framework and then really brought to attention some of the challenges and changes that we've had across paediatric critical care brought on by the COVID-19 pandemic, and then concluded by offering some sort of suggestions and recommendations as to how we could move forward in this post-pandemic context, and what are the key challenges that we're faced around multiple long-term conditions, medical complexity, climate health, austerity, and the significant sort of economic crises that we're seeing across the globe, and also the workforce crises. So bringing attention to that and then thinking forward as to what our focus as critical care professionals from across the globe could be around survivorship.
Absolutely.
So saying that we really need a coordinated, well-organised approach that features the whole multidisciplinary team, that really needs to be patient and family focused in everything that we do, that we need to do stuff that's in our control, in our sphere of power and authority, and that's around just because we've got the ways to the interventions, should we do it? So reducing the iatrogenic harm of intensive care, and then really thinking about what can we do, where's the evidence base, how can we collectively, as a global community of professionals, clinicians, scientists, come together and generate the evidence base to underpin, what does care pathways and screening look like to optimize the outcomes.
Absolutely. I loved your why this morning by how we started with peds critical care as just saving patients, and then evolving to where we are now of making the survivor experience even better, as well as within the hospital. So I love that. And I'm curious, there was a great question in the plenary session of what do we actually do? Yeah. What are some small steps that we can do to take the PICCS project forward and sort of do in our own institution? So I'm curious, if you have any guidance.
Yeah, and I think we've contended with this a lot because people want to do something, and I am absolutely 100% wedded to the fact that we have to step into the interventional space.
You've obviously been incredibly successful in your career. What recommendation do you have for a junior person just starting their career as to how to even just get started with research and sort of the whole science behind what we do?
Yeah, so I think there are two important things. I think there's about following your passion, and being really, I'm a bedside nurse. That's where my heritage began, and where my sort of appetite to generate the evidence base for clinical practice occurred, because I saw dissatisfaction in, the care that we deliver. So that's where it started for me. So to ignite the burn in the belly is find your passion, and that may sit wherever. We cover a lot of territory as pediatric critical care professionals. So find your passion, and then I think it's about your network and your mentorship. Totally. And I have been fortunate to be mentored by some absolutely phenomenal individuals. Dr. Martha Curley, who's a living legend within nursing, and probably the most successful nurse scientist within the pediatric critical care domain. Jos Latour, Anne-Sylvie Ramel, lots and lots of people have been very generous with their time and wisdom, and I think that's it. Reach out to people, be bold, be courageous, and have the confidence, because people are willing to help and support the future generations of our specialism.
Absolutely. Thank you so much for that.
Thank you.
I appreciate your time. Have a good rest of your conference.
Thank you.
All right. And I think Joseph talked to us so much about the importance of families. We'll be bringing on one of our family members in just a moment. But hello, nice to see you.
Hi, Tracy.
Hello, Roberto. I was hoping you could introduce yourself and where you practice, what your profession is, and what you're excited about here at WFPICCS.
Oh, really? Thanks a lot, Tracy, for this interview, for this space. I am from Argentina. I am from the north of Argentina, northeast, between south of Paraguay, west of Brazil, or south of Brazil. My city is called Corrientes. For us, it's a real pleasure to be with you for the OPENPediatrics, because we are a fan from OPENPediatrics. I am a university professor in the School of Medicine, and many of the ones that learn at this university, they take a look many times of all the stuff that you do in OPENPediatrics. It's very helpful. It's very helpful for all the world.
Wonderful. And how about here at WFPICCS?
Oh, I'm really very excited. This is the first time in many time with the pandemics that we can give a hug, we can see each other, we can give a kiss. We are this part of the world. We are this Latin. We like the hug. We like to talk with friends.
Yes.
We like to sit and a water, a coffee, and to talk many things. Not only medicine, families, and many things. At this new revolution that Joseph, Florencia, that she's coming now, about changing many of the things of this medicine, the health system, for including everyone.
Totally.
That no one step after us.
Absolutely.
Everyone has the opportunity. Maybe that doesn't mean that they have the same treatment, because sometimes they are treated in a low resort setting or low resort countries, but we, the health system, must do something to make that better.
Yeah.
And this includes families.
Yes. And we've heard so many of the plenary talks emphasize that throughout the year.
I am part of the scientific committee.
Yes.
With Joseph, Ali Ferguson from Australia, Joseph, Yolanda from Spain, Lorena from Colombia, Cynthia from the first thing we take a look on families, on patients. We can talk about especially the pediatric intensive care unit and many of the points, but we think we have to have a broader vision of when we are treating. We are not treating a disease, we are treating a person, a human being, and a family.
Yep.
And this is not just an adult that you are treating them, you are treating the family.
Yeah.
And we have to change that.
Absolutely. No, and I think we have a family member who's been speaking, who's joining us. So why don't we bring Florencia over?
Florencia?
Yeah. Wonderful.
And I know you're speaking Spanish.
Yeah.
She understands English, but if you speak in Spanish, she's better speaking in Spanish.
Well, my Spanish is pretty terrible, but you're going to help me.
I will translate to you.
All right. Mucho gusto.
Mucho gusto,
Yes,
igualmente encantada.
for being here. And we are so excited to hear your voice.
Y que está muy excitada de escucharte.
Sí.
And to hear and just remind us all of the work that we're doing to bring the families, that we're thinking about the children and their families as we do all of the care.
Que todo el trabajo que se están haciendo ellos, que estamos haciendo todos nosotros, es el de traer también a las familias a todos estos temas.
Bueno, sí, para mí es un honor, la verdad que agradezco y es un honor poder contar mi historia, la historia de Josefina, pero además aprender de lo que ustedes están haciendo y poder ver en primera persona el trabajo de tantos profesionales mirando la mirada del paciente y permitiendo que el paciente ingrese en los cuidados, no el paciente sino la familia del paciente en el caso pediátrico, es muy importante para nosotros poder contar caso a caso experiencias que me han pasado solo en estos 2 días que me permiten ver la importancia que tiene transmitir cómo lo sentimos nosotros.
Sí. Would you mind just translating for our English speakers as well? Yeah.
She's very excited, not only to come here to say what she's thinking, but also to learn from everybody from the health system.
Yeah.
Because she thinks that this conversation, communication between the health system and the family makes that the family learns about what they are doing, and from the physician what they are thinking.
Absolutely.
And many things that they are thinking sometimes make change in the way the people, the physician treat the patient.
Yeah.
And it's very important. That is the key thing.
Sí.
Nosotros llevamos en Uruguay una fundación que se llama Humaniza Josefina en homenaje a Josefina.
Their foundation is in Uruguay, is Humanize Josefina. Josefina is the daughter, is her daughter.
Yeah.
Ella fue paciente oncológico y falleció a sus 10 años.
She died at 10 years old. She was an oncologic patient.
Yeah.
Y en su ingreso al centro de oncología de mi país, ante su llanto, la rezongaron. Hoy una doctora decía lo importante que es ver que un niño llore y dejarlo llorar.
When Josefina entered at that time to the hospital the first time, she cried. And there was a physician and someone who said, "Don't cry." That's so now. Yesterday there was a physician here that told Florencia that it's okay that the children cry when they enter a hospital. It's normal.
Yeah, indeed.
Y ella pidió un cuaderno de quejas. Ese cuaderno de quejas que también la rezongaron por pedir un cuaderno de quejas, ella dijo, yo solo quiero hacer una lista de los que me tratan bien y una lista de los que me tratan mal. Y ese cuaderno de quejas es el que nos hace llevar su legado hasta hoy llegar acá.
Yeah.
Josefina had a diary, so where she wrote the people who treat her well and who treat well, who treat wrong. So and they ask why are you doing it? That's no. Because I want you, not you. I want to have a list of those who are well person and those who are bad person.
I'm a lawyer. This is
She's the lawyer.
Absolutely.
But not just for make some legal scene,
No.
but to say, hey,
it's very simple.
Yeah.
be kind with me.
Yeah. Sí.
In a restaurant, we can
Sí.
express. In a hotel, we can express.
Sí.
But in a hospital, not can express.
Sí. ¿Qué es una cosa para profesionales en el hospital que ayuda a familias y niños? I hope that was.
Yeah.
That's okay?
Excellent.
Sí.
Okay.
Your Spanish is better than my English.
Bueno, esa pregunta me la hacen siempre en la fundación.
They always make that question.
Sure. Yes.
Y yo siempre explico que mi fundación no se dedica a la ayuda directa a los pacientes y familiares,
She explained that there is no that the foundation is not just for directly helps the family.
sino a generar el cambio en los modelos de salud. Tengo un equipo de expertos en herramientas emocionales, como lo hago yo, y eso es transmitirles al personal de salud qué herramientas emocionales usamos nosotros y que les da resiliencia a ustedes en este trajín que es la salud.
They prefer to make changes in the health system.
Yep.
And they have a whole team
Yep.
on emotional tips
Yep.
on how to change the health system when they are with the patient.
Soft
not
skills.
just the,
Yes.
not, not just the family. They
Yeah.
talk with the family, but sometimes the problem is the health system, the
Sí.
whole health system.
See, yeah. I was just at a conference for the American Board of Pediatrics talking exactly about how do we ensure these soft skills and these non-technical skills are
yes.
excellent.
That's this soft skills
Yes.
that we must learn.
Yeah.
Even since a medical school.
Absolutely.
Yes.
Yeah.
Yes.
Yeah.
Sometimes
Fantastic.
we teach so much biology,
Yeah.
but not that soft skill.
Absolutely.
And we must humanize
Yes.
healthcare,
Yes.
especially through this soft skill.
Yeah. I agree.
Para cerrar,
Yeah.
porque sé que los minutos son, un profesor de la universidad, logré llevar la materia humanización a la Universidad de Medicina, y cuando estaba en las negociaciones me dicen, ¿por qué le llamás herramientas blandas? Y le digo, porque les dicen herramientas blandas, y me dicen, en tu duelo, ¿fueron blandas o la abogacía te ayudó más? Le digo, no, esto me ayudó más. Me dice, entonces no son tan blandas.
Yeah.
When she went to the university and talking with university professor, the university professor asked her, why are you calling soft skill? Well, because I said, no, how do you feel when they use it with you? No, it was hard.
Yeah.
That are no soft skills.
Totally. I love that. Well, thank you so much for joining us, and I look forward to having more conversations with you.
Thank you very much.
Okay,
Thank you
muchas
very much.
gracias. Yeah.
Gracias.
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 Yeah. Okay. All right, and we are here with our last plenary speaker, Debbie Long, and I'm wondering, Debbie, if you don't mind introducing yourself, where you're from, and your specialty, and then one or two key things that you hope people took away from your wonderful plenary this morning.
Okay, sure. My name is Debbie Long. My background's in PICU nursing. I worked clinically for 25 years at the PICU in Brisbane in Australia. And in 2020 I moved to academia, took a bit of a leap in the middle of COVID, so I could really focus on my academic focus
Nice.
as per Jeff this morning. So
I focus now on mainly long-term outcomes post pediatric intensive care, and really sort of specifically focusing on the neurodevelopmental outcomes in the cohort that sort of comes to ICU and has an adverse impact on the developing brain.
Absolutely. Yeah.
But today I didn't talk about that. I spoke about something that is equally important and associated to optimizing children's outcomes, and that is around family-centered care. I mean, the title of the talk was about the role of patients and families in the quality and safety mission, and just highlighting that patient-centered care is at the core of that, and evolved from that definition of patient-centered care is family-centered care. And when we look at that in our ICUs, yes, we say we've been doing it for a while, but unfortunately we don't have the evidence to support that. It's there, we're doing it, but we need to elevate it to the next level. And so currently our families are saying, and reported in the literature, that this partnership, which is so critical, the collaborative partnerships with compassionate and empathetic communication is a key, that a theme that's striking through all of the talks.
Absolutely.
Is open and honest communication. And even yesterday with Florenza, one of our consumers here, she's like, emotional intelligence is the soft skills that take it so far. But our families are saying that partnership is incomplete. And we really need to work on that. So that was the main take-home message. I touched briefly on some work that's come about more recently in PICU liberation, and how the family is at the center of that. And this is a beautiful way that we can partner with families and have them not only engaging in the day-to-day cares and decision making, but also in the creation of a safe PICU and what that looks like.
And you mentioned visiting hours and some of the questioning components. And in addition to making sure that that families can visit their children anytime during the day and night, any other suggestion, like a small thing that anybody could do to start transforming their units and sort of moving towards even more optimal care with the families?
For me, I keep coming back to social determinants of health. And I guess, and I probably didn't get the opportunity to talk about that much, is that often in the families that aren't as present at the bedside, it is because of other things going on in their lives, not the actual here and now of the child's condition. So it's taking into consideration what is happening in that family's life outside of the PICU, and trying to support them in those that then can facilitate parental presence. Is it because they can't get away from work? Is it because they don't have modes of transport? And that could be something really simple we can help families with. Is it that they have children that they can't bring in and they need someone to care for them? I think that some of those are really small things that can facilitate that being present, because once you have a present family, you can then engage them and partner with them collaboratively. If they're not actually able to get to the PICU for other reasons, that makes it extremely difficult.
We always talk a lot about advocacy, at a large scale and sort of political scale, but what you're describing is advocacy at the patient level. And I think that's so important, to have someone that can come in and speak with these families and try to figure out how to best serve their needs would be so important.
And I think the other thing is that once we have parents' presence, is role modeling and giving them permission to carry on as parents as usual. And I didn't say it today, but we were talking about it yesterday in the PICU Liberation workshop. It's simple things around parent and child bonding that build brain development and architecture, like serve and return. Having someone there in a loving, stable relationship with eye contact and conversation. And for a baby that might be babble, but it's still really important. So even being able to facilitate and role model that is really great.
Well, that is wonderful. Thank you so much for taking the time to share that with us. And I hope you have a wonderful rest of your conference.
Thank you.
Thank you so much, Debbie. Bye-bye. Great, and so that ends our afternoon session today, and we look forward to seeing you all this evening.